Hey guys, welcome back to my channel. If it sounds echoey, I am currently sitting on my bathroom floor. That is my shower curtain. But today's video is just going to be an update about where I've been the last few months as far as my depression goes. I want to make this sort of a series on my channel, maybe like once a month, a mental health related video. It's not always going to be this personal, and it's not always going to be this woe is me, because I know that turns a lot of people off, but this is just kind of where my head's been the last few months. And I would like to do a separate video as well for borderline personality disorder, which I have, and I know a lot of people don't know what that is, or they don't know much about it. There's tons of myths and stigma, much like other mental illnesses, so I will be doing a separate video on that. Kind of where I want to start is the medication I'm on. I mean, I'm on a few, but I've been taking antidepressants on and off since I was a teenager. Whether they work for teenagers or not is up for discussion. We're not really going to get into that because that doesn't matter. I think I started taking Cymbalta, which is what I'm on now, after having Genevieve. Like, she was probably 5 or 6 months old. But even before I had her, when I was pregnant with her and when I was in the hospital, sorry, I'm like physically holding this. When I was in labor with her, I told them, you know, I have a history of depression. I had postpartum with my son. I need to be medicated after she's born. And they didn't listen. And I had to wait until my 6 week checkup to be put on medication. You know, I could have called before then, but I felt like no one cared because I'd already addressed it. I had already warned them that that was going to be an issue. And, you know, lots of women, sorry, I'm trying to like stop moving. Lots of women suffer from like the baby blues where, you know, you're just kind of sad and bummed. But there's a big difference between, you know, just having the baby blues and having postpartum depression. For some women, they don't bond with their children. Luckily, that was not an issue for me with Genevieve. I mean, with any of the kids. Sorry, keep moving. But like I said, lost my train of thought. That wasn't an issue for me with her. I was just lonely. I felt empty. I cried a lot. And I told them that would be an issue. And like I said, they didn't listen. But I started Cymbalta probably after Jen was about 6 months old. And it was the first medication I've ever taken where I noticed a difference within a couple of weeks. Alex noticed a difference. It definitely helped immediately. Not immediately, but like tremendously. Like there was a difference. And of course, you know, that tapers off, which I don't know if that's true of everyone or if it's just my reaction to this medication, but it tapered off. And of course, I still have episodes of really bad depression, kind of like I have lately. I noticed myself starting to get bad again after Thanksgiving. And for about 2 or 3 weeks, it was just kind of like a numb feeling. And then it started to get slowly worse. The apathy kicked in, which is a huge thing that happens to me when I get depressed, is I stop caring specifically about myself. I always care about my kids and my family and my husband, but I don't care about myself. I don't care about my health. I don't care if I shower. I don't care what happens to me, like, with my job. Like, I just stopped caring. And this time around, it was even worse. I kept having this conversation in my head with myself, obviously. You know, like, what is the point of any of this? What is the point of life? What is my purpose? I felt like I didn't have a purpose. And, you know, when I went to see my doctor, the first time, because there was a couple times I saw her in the last couple weeks, you know, I was crying in her office and I told her the only reason I don't consider myself to be actively suicidal is because I'm so apathetic that I don't have the energy to do it. And that sounds terrible. And for people who don't understand depression, that sounds really terrible. But I just didn't have the energy to care enough to kill myself, or to cut, which is something I've struggled with since I was 12 years old. That's a whole nother story that maybe I'll do a separate video on, maybe not. But I didn't have the energy. I was exhausted. I could not get out of bed. I couldn't function. Until it got worse. And it got to the point where I felt like my kids and my husband were better off without me. And things happened. I'm not going to go into detail really about that. But it's really hard when you're in that dark of a place to think logically, you know, even though in the back of my head and logically I know there's people who care and there's people who love me. That doesn't matter when you're that deep in, because it feels like no one's there. Because you don't want to be a burden, and that's how I felt. I didn't want to bother anyone with it. Yeah, but my doctor did put me on another medication on top of the Cymbalta. I haven't noticed a huge difference with it yet. I've only been on it a few weeks, but it actually is kind of helping my hip and my pelvic pain, which is good. And after this past week, which when it was the worst, and I had to go see my doctor multiple times and a bunch of other shit, and I literally could not get out of bed. But anyways, I've started group therapy, individual therapy, and I hope it helps. Like right now, I'm slowly getting out of it. I'm getting out of bed and I'm putting makeup on again, which is a nice distraction for me. So I'm getting there, but the other thing that's been different for me this time around, like I suffer from a very general anxiety. It's pretty mild for the most part. If I'm in crowds, if I'm overstimulated with noise, it's a big thing for me. But the past couple of weeks, I've had several anxiety attacks. I posted on Facebook about the one where I was at work and I started crying for no reason, and I couldn't breathe and my chest hurt, and it was really scary. And I don't know if that had anything to do with how depressed I was, and maybe, but so I'm going to be working on that as well. And the one thing that I really wanted to say in this video was, for whoever's watching, is I understand what it's like when you really feel like you can't reach out to anybody, or you feel like there's no point. And I completely understand that, because that's exactly where I was. I didn't have a choice this time around. You know, they forced me, but someone does care. I promise you that. And there are resources out there. You know, I'm not an expert, and obviously I'm still struggling and I'm still working on myself. But if you ever need anyone to talk to, message me on YouTube, Instagram, Snapchat, Twitter, Facebook. And even if I don't have the answers, because I don't have my shit together, but maybe I can point you in the right direction. And I'm hoping on future videos, I can focus on more positive things like tips for anxiety or coping mechanisms I've tried, assuming that I find something that works for me, and I'm sure I will. But I feel like I've gone off on tangents on this video. It's not as organized as I was trying to do it in my head, but yeah, I want to make this a series. I want the stigma and like the bullshit things that people say about mental illness, like, it's just the holidays, you know, you're just stressed. Yeah, I'm under a lot of fucking stress, but stress doesn't make most people attempt suicide. Like, I'm sorry, but that's not normal. That's not a normal response to stress, or to like the stress around the holidays. That's not normal. So I really want the myths and the stigma to just stop, because it's not helping anybody. So yeah. Okay. Like I said, I am gonna make future videos. The next one I'm probably going to do these kinds of videos like once a month because that's obviously not what my channel is about. Next video I want to definitely do on borderline personality because that factors into my depression and my anxiety and about a bunch of other things about me a lot. And there's just a lot I want to talk about on that subject. My hair's a mess. But yeah, so if you guys, I'm not gonna say if you liked this video, but if you do think I should do more mental illness based videos or things along that line, then go ahead and give this video a thumbs up. I know it was really all over the place, but I kind of just wanted to let people know where I've been because I've been kind of absent. And I've had a lot of people message me because of certain things I've posted just to see if I was okay. And I'm getting there. And I hope you're okay. And if you're not, I hope that you reach out and talk to someone, anyone, because I promise you that someone cares. So thanks for watching, you guys, and I'll see you in my next one. Bye.